It didn't come from spoiled food. It didn't come from a hospital bed. It came from sheep during shearing. Campylobacter fetus is a bacteria that most people will never hear about in their lifetime. It doesn't trend. It doesn't cause outbreaks that make headlines. And because of that, it often moves undetected until it crosses the species barrier. This bacteria lives quietly inside sheep and cattle. In livestock, it's common, controlled, almost invisible. Farmers, shearers, veterinarians, people who work around animals every day, can spend years exposed without ever knowing it's there. Until one day, the barrier breaks. Sheep shearing is physical. Hands grip wool. Skin presses against animals. Equipment moves fast. And during that process, tiny cuts happen constantly. Microscopic breaks in the skin. Too small to notice. Too small to bleed. That's all Campylobacter fetus needs. Unlike the Campylobacter strains most people associate with food poisoning, this one doesn't stay in the intestines. It doesn't cause violent vomiting or obvious gut symptoms. Instead, once it enters the body, it takes a very different path. It goes straight for the bloodstream. This bacteria has a unique ability to survive immune attacks. It coats itself in protective proteins that help it evade detection, allowing it to circulate quietly through blood vessels without triggering an immediate alarm. At first, the symptoms don't seem serious. A low fever, fatigue, aches that feel like the flu. Most people write it off. They keep working. They rest for a day. They move on. But underneath, the bacteria is spreading. As Campylobacter fetus moves through the bloodstream, it begins attaching to the inner lining of blood vessels. From there, it can seed infections in places that were never exposed directly: heart valves, joints, the brain. This is where the danger escalates. In some cases, the bacteria settles in the heart, causing endocarditis, a condition where infected heart valves slowly deteriorate, disrupting blood flow and throwing clots into the bloodstream. In others, it reaches the central nervous system, leading to meningitis, an inflammation that can cause confusion, seizures, or sudden neurological collapse. And then there are the cases that hit hardest: pregnancy. Campylobacter fetus has a disturbing ability to cross the placental barrier. In pregnant individuals, what begins as mild flu-like symptoms can suddenly become catastrophic. Miscarriage, stillbirth, severe maternal infection, often without warning. By the time doctors realize what they're dealing with, the bacteria is already systemic. Blood cultures take time. The organism grows slowly. And because it's rare, it's not always considered early in diagnosis. This delay is critical. Antibiotics can work, but only if the infection is caught in time. And because Campylobacter fetus hides so well in the bloodstream, treatment often requires long courses of intravenous antibiotics, sometimes combined with surgery if heart tissue is involved. This isn't a contamination story. It's an exposure story. A reminder that zoonotic infections don't always come from what we eat, but from what we touch, handle, and work with. Modern medicine often focuses on hospitals as the source of danger. But for some infections, the risk begins far earlier. On farms, in fields, in routine work environments that feel safe because they're familiar. Campylobacter fetus doesn't announce itself. It doesn't cause outbreaks. It doesn't spread easily between humans. But when it crosses species lines, it hits hard, and it hits deep. This is the reality of spillover infections. Rare, quiet, and often underestimated until they're already inside the bloodstream. And once that happens, there's no such thing as a mild case anymore. Subscribe for updates on future episodes.